Okay.
Hey, Dr. Alexander, this is Pam Hurdy here doing the CDFE. I was originally going to do it on my son with his size 13 feet. However, when I saw my case manager Leanne Smith's green toenails today, I couldn't resist those, so I thought, well, let me go ahead and do this on Leanne. We've got the extraordinaire Barbara Knowles here as well, being our master filmmaker here, so just here to do that. Thanks for a great semester too this semester. So before Leanne even comes into my office, fortunately Leanne is not a diabetic, but if she were, I'd already known does she have a history of peripheral vascular disease, has she had a bypass, angioplasty, is she having claudication symptoms, pain, anything like that. Hopefully I will have known that, and also will have done some labs on her too, a BMP, CBC, so I could assess her renal status. She knows her BU and creatinine within normal limits, how's her GFR, those types of things, so just kind of taking a look at that. Also, on her way back to the office, I'm going to watch how she walks. You know, as a yoga teacher, I'm always watching how people stand, how they walk, those types of things. All standing postures begin with the feet. Someone noticed, does she have an abnormal gait pattern? Because if she does, that somehow may be caused by her feet. I'm not sure, could be some other things. Also, just noticing how she's walking in her shoes. Are her shoes fitting properly as she's walking? Just some inspection there. And just noticing how she is on her feet as well. You know, is she supinating? Is she pronating? I can do that by shoe inspection as well, but sometimes just watching people how they walk can give me a lot more information. When she sits down and takes off her shoes, I am going to take a moment to inspect her footwear. A lot of times diabetics, because of loss of sensation, really don't know that their feet their footwear is not fitting properly. Most trauma for diabetics in terms of foot ulcers are caused by improper footwear, so I'm definitely going to go ahead and inspect her shoes and make sure that they are fitting properly. Then I'm basically going to go ahead and prop this leg up, make sure she's got some good support here behind her knee, because I don't want to compromise that knee joint, and just do a nice general inspection here. So basically I'm looking for, gosh, do we have any edema here? I'm going to start that inspection above the ankle. Is the skin nice and warm? Is it all intact? I'm going to take a look at everything here. Basically I'm looking for venous insufficiency or arterial disease, so I'm looking for shiny and hot and red, or gosh, is it discolored and cool? I'm looking for any breaks in the skin here. I notice that Leanne has some little crusting here. If she was a diabetic, this would be of concern for me, but since she's not, we're just going to tell her to go to Bath and Body Works and get a good lotion here. We're going to take a look at, is there any dystrophy of the nails here? You know, are the nails clean cut? How are they? Is she taking care of her nails? Are they cut straight across? Am I seeing any ingrown toenails? I'm looking between the toes as well to see any fissures or cracks. I'm also noticing in terms of smell, you know, is there a yeasty smell? Is there a fungal smell? You know, just using all my sensations as I'm looking here. I'm also going to check her pulses, her post-tibialis, and then her dorsalis pedis. Basically, are these intact as well? One of the videos said, gosh, either they're absent or present. Another one, Dr. Peters actually ranked them from 0 to 2 plus, 0 meaning totally absent, 1 meaning diminished, and 2 plus meaning they're totally intact, which Leanne's are. If her pulses were not intact, I'd definitely be making a referral to a vascular surgeon, because they basically would need to do pretty much a brachial ankle kind of test for her to check on those pulses as well. So then basically I'm going to kind of take a look at the foot itself from a musculoskeletal standpoint. Am I seeing any deformities in the foot? You know, is the arch normal? Do I have any bony deformities like in a Charcot tooth foot? You know, and they all look pretty intact. Leanne can do some toe tricks too. She showed me those earlier, so I know that she has good strength in her toes. Then I'm going to have her press on my foot to test her strength. Then pull that foot back. Gosh, she's got some good muscular strength too, so I know that we've got some good strength in here, so we've got some good sensation as well. So the next thing I'm going to do is a neuropathy assessment, which basically has a couple of parts. The gold standard is the monofilament test, which would be using our monofilament here and seeing if Leanne could feel that on the first, third, and fifth metatarsal, as well as the front and along the back of the foot. The second part of that is either using the tuning fork, a pinprick, or using the ankle reflexes or VPT monitor. The tuning fork is the one I'm going to be using today to basically kind of test to see if she has a vibratory sensation. So use both of those to assess her ability to kind of sense anything on her foot. So I'm going to have Leanne close her eyes. And I'm basically going to touch her first, third, and fifth toe here. So, and she's going to tell me when she can feel this. So here we go.
Yes.
Okay.
Yes.
Okay.
Yes.
Good. Now we're going to go to the back of the foot.
Yes. 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 Yes.
Good. So from a monofilament standpoint, she's able to fill all those pinpricks. The only thing I have to be, or those touches, the only thing I have to be a little bit concerned about, she doesn't really have any significant calluses, but if she did, sometimes on the dorsal aspect of the foot, they will not be able to sense those monofilaments as much. So the next thing I'm going to use is my tuning fork. I'm going to test it on myself first to make sure that I can feel it, which I can. And basically, I'm going to place the tuning fork on Leanne's great toe, and I'm going to see if she can tell me when she stops feeling the sensation. So she's going to close her eyes again. Okay, and tell me when you feel this stop, Leanne.
Now.
Okay.
Now.
Okay, good. So she's good there. She has a nice vibratory sense and a sensation intact, so that's intact as well. So I'm feeling pretty good about her foot right now. She is not, her sensations are intact, her pulses are intact. I'm not seeing any deformity in the foot, so she's in a risk category 0, which means that I'm just going to need to make sure that she knows how to do her foot exam, and also I want to see her back every year for the exam herself, as a certified foot exam itself. If she had lost a peripheral sensation or some type of deformity, I want to see her back in my office every 3 to 6 months. Again, I want to make sure that she knows how to do that foot exam herself as well. Risk category 2 means that she has some loss of pulses. I'm not feeling any pulses there, and she also has a loss of peripheral sensation. I'm going to want to see her back every 2 to 3 months, but I'm also going to send her on to a vascular surgeon. Risk category 3 means that she's either had an ulcer or she's had an AML. Definitely will be seen every 1 to 2 months by a specialist. She'll be in a high risk category for that. All right, I think that pretty much sums it up for the diabetic foot exam. Leanne, thank you so much for being my subject
You're
today.
just welcome.
Thank you, Barbara Knowles. I appreciate your master filmmaking techniques, and thanks, Dr. Alexander, for a